So Richard, thank you and welcome. You are a hemophiliac yourself. You are a patient.
I am.
Thank you for coming and your willingness to share your story.
Great. Well, good afternoon, everyone. I come before you today not only as the executive director of the New England Hemophilia Association, but I am a patient living with hemophilia myself. Hemophilia is an inherited, rare genetic condition that only affects about 20,000 people nationally. In the state of Rhode Island, it's estimated that there's about 150 to 200 patients. Individuals living with hemophilia lack the ability to make one or more blood proteins involved in the clotting process. Without treatment, people with hemophilia bleed internally, sometimes as a result of trauma, but sometimes spontaneously as a result of normal activities. This bleeding can cause to severe joint damage and permanent disability, or even death. Hemophilia treatment today can only be administered on a regular prophylactic basis or on demand through IV infusions or subcutaneous injections. These life-saving treatments cost an average of about $350,000 a year. It's important to note that there are no generics for those living with hemophilia. This medication allows people to live normal and active lives. 75% of the world does not have access to treatment, and the life expectancy is under the age of 30. So we know treatments are working and is able to give people that healthy lifestyle. While hemophilia treatment is undeniably expensive, subjecting hemophilia patients to step therapy puts us at risk, is not effective or appropriate way to manage this condition. As you heard today, in particular with hemophilia, treatments are biological products and are not therapeutic, and there are no therapeutic equivalents or interchangeables associated with this right now. Prescribing treatments is a complex exercise that has to be left to hemophilia specialists. We have a hemophilia treatment center that's federally funded at Rhode Island Hospital, and there's a pediatric clinic at Hasbro. And at these clinics that are federally funded, patients consult with their physicians to see which products work for them, as there's no one-size-fits-all model for those living with hemophilia. Allowing timely patient access to the most appropriate treatment will result in better treatment outcomes and lower treatment costs. Policies like step therapy are unacceptable because the consequences of treatment of failing are so serious. The impact of a major bleed or of damage from multiple joint bleeds can impact into just way too many severe results. Also, there is no clinical definition of what constitutes as failure on a product for a person with hemophilia. Step therapy potentially subjects these patients to unnecessary harm during an experimental process just to lower costs and goes away from what the physician is prescribing. I'm going to share a personal story of what happened to me. And I want to preface this with I am extremely lucky, and that there's many that are not as lucky as I am. So I live in Providence. Our office is up in Dedham. The organization that I run serves all of New England. Because this is a rare condition, there are no state-based organizations. I currently have insurance through Health Source RI, and it's working great, until last year. So for the past 10 years, I've received a monthly shipment of medication from a specialty pharmacy and usually 2 or 3 large boxes that are full of ice. These boxes contain the medication that I infuse every other day through IV. So what that means is I put a tourniquet on, just like when you get blood drawn. It's a tourniquet made for people that do it themselves on my arm, and I find a vein. So ultimately, you become a phlebotomist. Once you find the vein, you can administer through intravenous this life-saving treatment. The process takes about 5 minutes, and it gives me the protection that I need to avoid spontaneous bleeds from bleeding excessively if there was an injury like a car accident or falling or having an injury just doing normal daily activities. The cost to my insurance each month is about $40,000. When my health plan changed last year, I was notified that I would no longer have access to the treatment that I have been on for the last 10 years, same dose, same treatment. In the letter that I received, I would have to enter a review process, which could include step therapy or failing first. I'm used to prior authorizations. Many patients that have specialty drugs are used to that term. I'm used to it being a couple of days to 72 hours, but this was a unique process. In the letter, it gave me 3 weeks to figure out the documentation that I needed. I quickly called my hemophilia treatment center and my providers and started assembling a case of why all of a sudden, out of the clear blue, that I had to now put forward the documentation necessary to get my monthly shipment. As I mentioned, 3 weeks is not enough time for someone that has a full-time job who needs this medication each month. Leading up to a decision being made by individuals sitting in office was a grueling and stressful process. I personally spent nearly 10 hours on the phone with my provider, nurses, doctors, social workers, and with my insurance company to try to figure out how this happened. Even though we submitted the paperwork before the deadline that we were given, a decision was not granted until 2 weeks after that deadline was said to us, and means which I had a delay in processing my monthly medication. Therefore, I went without treatment for 2 weeks. Thankfully, I was not forced to go through step therapy at this time, but I was instructed by my insurance company to go through many loopholes that were unnecessary to get the same treatment that I was on. I was also told that once a decision was granted, that this new process would have to be a annual thing that I would have to go through in terms of the acceptance. As the executive director and a professional of the New England Hemophilia Association, I went through this process with the necessary tools in my tool belt to contact the right people, healthcare providers, the insurance company, to help me navigate this very complicated process that I had no control over. What happens to other patients is that they're not as lucky to have all these tools and resources. What if they implemented a step therapy protocol? What if my prescription did not go through after 10 years of being on this drug? What if all of this stuff that I was used to did not get passed? I sit here today because I ask these questions that outside of step therapy, there's a lot of jargon that is being put in front of patients that's extremely confusing. Rhode Islanders need patient protections around the adoption and use of not only step therapy protocols, but other terms by insurance companies like these prior authorizations, which are taking way longer than 72 hours. Health plans that are requiring them. This process must be transparent in a way unlike what was given to me and based on a sound clinical evidence besides just deciding that this is a new process. We stand with the other patient groups here to advocate for a clear and convenient process for enrollees and prescribers to obtain such exceptions from these type of protocols.
Thanks, Rich.
Richard, question. If you had to have a planned surgery, would that take weeks in advance to prepare your body to withstand the surgical procedure? And does that need prior authorization too?
Yeah, it's a great question. So what we do is my physician writes a script once a year for my prophylactic dose, which is 2,000 units every other day. And that's my allotment of what I can get per month. They also write a dose of an emergency dose that if I go over those doses, I can order up to a certain amount, and that's the threshold. If there is a surgery or if there is an emergency, it does have to get pre-approved through the prior authorization process. What was told to me that if this went longer than that 2-week window is just come to the hospital and we'll put it through that way. That's not the answer for patients to get this medication of you can come inpatient to get the medication. So to answer your question, there is a threshold that is given to us, but the prior authorization does need to go through by surgeries currently for those living with hemophilia.
And you did refer to an accident, so God forbid, you had an accident on Route 95 and had to be rushed to, say, Rhode Island Hospital, and you needed blood transfusions. And maybe Dr. Ritchie can help us with this. You would not be denied those transfusions because you had no prior authorization. I mean, they wouldn't.
My understanding is no. They would give me those clotting factor medications that is needed. And even if I'm not quite sure how it works in a situation like that, but the patients that we've had that have been in car accidents have been given the medication up front because we also know this saves lives. So outside of that, the clotting factor must be administered immediately. And it's sad. I mean, we've had patients that go to the ER and they know that it's going to take time or that there's insurance barriers, that when it's not an emergency situation. And patients say that they're infusing in the parking lot or they're infusing before they go in when they should really wait for their levels because they know it's such a gruesome process sometimes to acquire the medication. But I think in an emergency situation like the one you described, patients would have access to the drugs that they need.